The COVID-19 vaccines are really miraculous, actually, and it's based on technology that's been developed really over the last 50 years in terms of our understanding of science and cellular biology and really the blueprint that tells our cells what to do and how to behave. So I'm talking about the DNA and the RNA, the things inside our cells. So part of the reason why it was developed so quickly is we had this tremendous foundation of science that's been developed over a very long time. And we were able to leverage that technology into these really remarkable vaccines. The other way is that we just put a lot of resources toward this problem. Operation Warp Speed was the government program that helped put resources into vaccine development. And so never before have we actually had manufacturers scale up production of vaccine before the FDA had authorized the vaccine. So normally it would happen the other way around. From a business process standpoint, you would have the vaccine authorized or approved, and then companies would make it. So we put so much resources into this problem because it was so important that we were ready to manufacture the vaccine. So as soon as it was ready, the first day it was ready and approved or authorized, it was available to be distributed and delivered. So these vaccines are some of the most effective that have ever been developed in history. Vaccines that are over 90% effective are just remarkable, and that's what these vaccines are. So the way the vaccines are developed, there's no COVID virus actually in the vaccine itself. So it's only basically the instructions that tell our cells in our body to make a part of the viral protein. So what happens then is our immune system recognizes that protein is not ours, and we develop an immune response to it. But when we inject somebody with the vaccine, there is no actual COVID virus. There's nothing that can cause a COVID infection. Many of us will experience symptoms. We'll experience maybe some fever, or some chills or some general fatigue after we get the vaccine, usually after the second dose of the vaccine. Very common, and that's actually a good thing. That means your immune system is working. When we feel those symptoms when we're normally sick, it's that our immune system is working and try to fight off the virus. So the vaccines are really good at ramping up our immune system and creating those symptoms and that healthy immune response. So people that haven't gotten sick yet, or maybe have been exposed to COVID, didn't get sick, it's still really important to get vaccinated. And part of the reason is that this virus is with us now, and so it's important to continue to protect yourself because you have the chance to be exposed in the future. It's also important because there are people who can't get vaccinated, right? That are very, very susceptible to a bad outcome from COVID. And by all of us getting vaccinated, it creates that herd immunity that protects those of us who can't get vaccinated. And right now, that's children. That's a fair number of elderly adults or people that have compromised immune systems. So whether or not you feel that you personally may be at risk, there's a community element of this. And this is about not just taking care of ourselves, but we're taking care of our friends, our neighbors, and the people we care about. COVID's interesting in the sense that we have all these different variants circulating. And we know, actually, we know really well now that immunity doesn't last for very long. And so very early on, we actually realized that there were people getting COVID 90 days, 100 days after they had an initial infection. We've actually had cases of that here in Jackson. And so that level of immunity just doesn't last very long for people that have had COVID already. For some people, it may last longer than 90 days. I mean, it could last, a year or two even potentially, based on other coronaviruses that we know about. But that's not long-term protection, right? There's going to be some finite time frame on how long someone's protected from COVID if they've had the infection. The other reason I was talking about the variants, so getting one variant may not really make you immune enough, right, so to speak, to all the other ones because they continue to change. The beauty of the vaccine is that the vaccine is designed to create an immune response to what's called the spike protein. And that spike protein is very similar across the different variants. And so it helps create kind of a more robust and broader immunity than we may develop from just getting the infection. So not only is there kind of a finite length of time on the infection, the vaccine, or on the immunity from the infection, the vaccine can create sort of a broader type of immunity that gives us more protection against the different variants as those seem to keep developing. I think there's a couple key or really important points on this. So the first thing is that no vaccine is 100% effective. So we've known from the very beginning, the mRNA vaccines in particular are over 90% effective. That means if something's 95% effective, 5 out of 100 people are still going to get it, right? So it's not 100%. So we always know that's the case. The second point is the vaccines are very effective, like 100% effective at preventing death, which is a very important endpoint that we want to try to avoid. And virtually 100% very close at preventing hospitalization. So when you talk about the really severe outcomes, they're very good at that. Unvaccinated people die and are hospitalized at much higher rates than folks that have been vaccinated. So even that kind of smaller group of people that have what's called a breakthrough infection that were already vaccinated, they tend to have much more mild symptoms than somebody that ends up or that isn't vaccinated, gets COVID, and is much more likely to end up hospitalized or even die from the disease.